Go ahead.
So I'm really looking forward to, sorry, I'm in a public place. Just give me 1 second for this. It's been quiet for a long time and suddenly there's a crowd. Anyway, I'm, been really looking forward to this talk for a long time. Summer heat is something that's, concerns about it very close to my heart. And since I spent part of my time in northern India, which has been hot for centuries and is just unbearably hot every summer again and again, even more and more. So I'm really looking forward to this. And Danielle is an assistant professor in the Yale School of Public Health, Dr. Danielle Carrion. He's an environmental health scientist focused on the intersection of climate, energy, and health inequity in the US and internationally. He uses environmental data, health data, and energy data to conduct environmental social science, exposure science, and epidemiological research. His work is designed to support interventions around heat, air pollution, and maximizing the health benefits of energy transitions, including work on energy insecurity. Though his current work, his research and teaching is focused on environmental health and justice in the United States, his doctoral work was focused on energy poverty, household air pollution related to cooking, and health in Ghana. This has led to a career bridging among social and environmental justice issues, research and policy, science, and community studies. Professor Carrion is a member of Yale's Center on Climate Change and Health and director of its education programs. He is a former member of the New York State Health Equity Council, among many other distinguished appointments. So, Danielle?
Great. Thank you so much for that introduction. Let me get this sharing thing happening. All right. It's always great to come and chat with Yaleys. I think you all are out in the world experiencing these things, and I love the ability to have some crosstalk based on where you are and the type of work that you do and how you're seeing these things manifest in the world. And so I'm going to talk to you about my work specific to energy insecurity and summertime energy rationing in a changing climate, and some background that I'll give here on climate change, energy, and health. And then I'll speak about two projects that, while distinct, I think you'll see an important thread between them about temperature disparities in the northeastern states of the US, and then energy insecurity and rationing in New York specifically. I think the background here is pretty apparent to the folks in the room. We know that climate change is with us, and many of the benchmarks that we've created in terms of international policies are increasingly unrealistic, unfortunately. So many of the international treaties around climate change have targeted 1.5 degrees Celsius of warming and limiting warming to 1.5 C. And unfortunately, it seems that that is increasingly unrealistic. 2024 was the warmest year on record, and this is a slide that, of course, we have to update annually because increasingly every sequential year is the warmest year on record. Depending on who you ask and what climate change projections you believe and what we believe about what society will do in the future, it's likely that we'll hit something around 3 degrees of warming by the end of the century. Although, of course, there are many large uncertainties, including the ones that I just mentioned, but then also things like climate tipping points, where we may hit some sort of system threshold in our climate system that propagates continuous warming. Uh, and so wrapped up in that, we know that I do not know what that crunching noise is. uh, okay. So we know that essentially what has driven uh, climate change has been our historical choices and our present day choices in energy. And so I'm excited that someone is on the call who is thinking about green energy solutions like green hydrogen. These things are incredibly important because energy is fundamentally driving our climate crisis. But we run a fundamental tension here because energy is driving our climate crisis, and yet we know we need energy for health. When it comes to the energy that we rely on for our cooking, to the energy that we rely on for our cooling, and the energy that we rely on for our heating, we need energy. And historically, all of these energy sources have come from combustion, which, of course, then contributes to climate change. So I've been fortunate to work in all three of these spaces in my career, given my interest at the intersection of energy and health. But today, I'm going to focus specifically on my work on cooling. And then another piece of context that I'll lay here as I'm thinking about inequities, disparities, and how to work towards a society where we reduce these disparities and prevent these disparities. I think that this quote was very compelling to me when I first read it. This was from the Lancet Countdown on Health and Climate Change. This is a group that puts out reports each year essentially on the status of climate change and health through the Lancet. And they said in their 2023 report that climate change is the greatest global health threat facing the world in the 21st century, but it's also the greatest opportunity to redefine both the social and environmental determinants of health. And so it's really at this intersection that I think of my own work. So given that little bit of preamble, I'm going to talk about this first analysis, this first paper that we did on residential segregation and summertime air temperature across 13 northeastern US states and the potential implications here for energy burden. On the health side of things, the background here is pretty straightforward. Temperature varies quite dynamically in time and space, particularly within cities. And while most people are familiar with the urban heat island effect, whereby cities are hotter on average than surrounding areas, we also know that this is actually much more nuanced. When I go for a run in New York City during the summer, I can feel temperature changing quite profoundly between neighborhoods, something that we often refer to as the urban heat archipelago effect, that we see this patterning of temperature throughout cities as well. And we also know that temperature is a major driver of health. In 2023, there were approximately 11,000 deaths that were attributable to heat in that summer. And that's just from mortality. In terms of ER visits, for example, there was another study that showed approximately 120,000 ER visits from heat in that same year. And we know that heat affects health through many different health pathways, bodily pathways, including cardiovascular outcomes, respiratory, renal, even psychiatric and accidental deaths. And past literature has identified strong relationships between forms of disadvantage and local temperatures. Some of those have included associations between income and social vulnerability with temperature. Others have associated things like redlining with present day land surface temperature. But it's important to note here that redlining took place in the 30s and 40s in many cities around the United States, but developed land area and populations have grown substantially since then. So there's an important opportunity to think about present day forms of segregation, as those are both more proximal and things that we can actually intervene on today. Another important system of inequality to track for this particular study that I'm talking about is energy insecurity. So energy insecurity, kind of operationalized sociologically by my colleague, Diana Hernandez at Columbia, represents the interplay between energy needs, financial constraints, and behavioral adaptations. And though there's a lot of rich sociological theory here, I think this is pretty intuitive to folks through what's often referred to as the heat or eat dilemma, the kind of precarious trade-offs that people are making during wintertime months, where they choose to keep themselves warm during the winter or maybe forego a nutritious meal, maybe not re-upping pharmaceuticals or prescriptions that they need so that they can pay their energy bill. And so what I and others are pushing us to think more about with a warming climate is what I refer to as the heat stroke or go broke dilemma, that people could be increasingly making these types of trade-offs during summertime months. And one of the only policy tools that we have against energy insecurity are financial assistance programs like the Low-Income Home Energy Assistance Program. LIHEAP, for short, has been historically only used for distributing wintertime energy assistance, but there's been growing recognition that it's an important tool to combat summertime energy insecurity. The main metric of LIHEAP for comparing areas for the sake of allocation are cooling degree days, which are an indirect measure of energy demand for cooling. However, a challenge here is that when the work is done to calculate cooling degree days, it's usually done for very coarse geographic units. So you could see in this plot that I have here that it says, for example, in the mid-Atlantic, that there were 828 cooling degree days in that region. But that's a pretty coarse region, a very coarse spatial scale. And given the background that I just gave before, that cities and other areas, there's quite dynamic changes within these areas around temperature. So with all of that as being taken together, we thought that this was an opportunity to put two distinct literatures into conversation. We wanted to examine whether or not there was evidence of localized air temperature disparities throughout a summer. That is, if a particular ethno-racial group was exposed to warmer or cooler temperatures compared to a county average. And then we wanted to investigate whether present-day measures of segregation were associated with air temperatures as a potential pathway explaining these disparities. To accomplish this, we leveraged an air temperature prediction model that we developed back in 2021 using satellite data, earth science data, and ground observations with machine learning methods to create historical reconstructions of hourly temperature at a 1 kilometer resolution. And so for illustrative purposes, this is a map of those predictions for the hottest midnight of the data set. So this was the data set that we used for our temperature data. And so given that this was limited to the Northeast and Mid-Atlantic, this was where we conducted the study. We have these temperature predictions from 2003 to 2019. So that allowed us to look at those relationships between the temperature predictions and local temperatures at census tracts. In this region, there are approximately 18,000 census tracts representing 434 counties. And so we aligned those temperature data and the census tract data to then look at the demographics of these temperature exposures, looking at cooling degree days. I mentioned cooling degree days before. If you're unfamiliar with this metric, it sounds fancier than it is. Essentially, what it is a measure of how much hotter a particular area is than a threshold temperature. So typically, the threshold temperature is 65 degrees Fahrenheit. So if today were 67 degrees Fahrenheit, then we would accrue 2 cooling degree days. And then you would do that for each sequential day and then sum across all of the days in the season. And that gives you essentially a measure of how hot that season was, and as an indirect measure of energy demand for cooling. Just for the sake of seeing what those temperature and demographic data look like, these are some plots of density distributions for specifically the year 2013 by ethno-racial group. Oh, sorry. You can see, let's look at New York as an example. New York, you could see that white New Yorkers experienced cool summer on average than Latino, Black, and Asian New Yorkers throughout the state. That said, and then you could look at Delaware as another example where we don't see much different throughout the state. We don't see it as pronounced of a relationship. That said, this is just kind of descriptively looking at the data throughout the state, and clearly we know that populations are not distributed equally throughout the state. And so in order to do this, we did some statistical modeling where we essentially looked at within county comparisons by race and ethnicity for the first analysis. And then for the second analysis, we used a measure of residential segregation developed by demographers to essentially look at a spatially smoothed metric of segregation that could be interpreted essentially as percent of each population group. So this is a visual of the main results for the first analysis for 3 specific counties along the region in Maine, New Jersey, and West Virginia. Broadly, what you can see here is that Black and Latino people experience higher average temperatures, and white folks experience lower than average temperatures when compared to the county mean. This is just a tabular form of those same results from these statistical regressions that we ran. And like I mentioned, broadly speaking, throughout all of the states, we see that Black and Latino people had the highest differences from the county mean. Specifically, Latino people who had the highest consistent differences that were all statistically significant. Asian people showed mixed results based on state, and white people were consistently below the mean. When we then investigated our measure of segregation, we found that higher spatial concentrations of Latino people were roughly monotonically associated with higher temperatures, meaning throughout the range of concentrations, we see higher concentrations means higher temperatures on average. Whereas Black people, interestingly, showed some bode associations, meaning that we saw some of the highest temperatures at the kind of middle range of concentrations, and then it started to dip a little bit. But then white people consistently showed negative associations at the highest concentrations, meaning the higher concentrations of white people, the lower we expected temperature to be throughout these regions. So we found these results interesting because they kind of fit into some other observations from the energy literature. Non-Hispanic Black Americans are the most likely to experience year-round energy insecurity, but other literature has shown that Latino Americans are the most likely to experience summertime energy insecurity. So perhaps then warmer temperatures are one pathway through which summertime energy demand may operate. All of that said, unfortunately, there are actually very few states nationally that support summertime energy assistance. And depending on what happens at the national level around budgeting for assistance programs, it may be the case that there is not a lot of money to support summertime energy assistance at the federal level. These and other topics are things that we talked about in a separate paper that was a little bit more digging into the nuances of that low-income home energy assistance program. And so if you're interested more on the policy wonk side of things and you want to know more about our perspectives on energy insecurity and the low-income home energy assistance program as it pertains to climate change, feel free to reach out, and I'm happy to share more based on this paper. With that, I'm going to pivot into another project, this one specifically on summertime temperatures and energy rationing in New York State. I should mention that this is work that's currently under peer review, but it's available as a preprint, so you can access this still freely online, but just knowing that it's still under peer review at the moment. And so the background here and what ties some of these things together is that I mentioned energy insecurity has several elements to it. And one of the elements of energy insecurity is around behavioral adaptations, or what some people would refer to as energy rationing. That is that some people may ration their energy use for fear of the corresponding bill that comes along with it. In relation to temperature, there are people who have investigated this issue and referred to it as the energy equity gap. However, these investigations have been largely limited to a couple of regions of the US. In Arizona, there was one study that's cited here, and in Illinois, there was another study cited there. We thought that this was an exciting opportunity when we found that New York State actually made a large amount of historical energy data available online. So we thought that this was an opportunity to add to this literature with almost complete state coverage throughout New York State. And this is quite simply a visualization of those raw data where each line is one zip year. So for example, in New York City, one of the zip codes is 10029. And so one of those lines, for example, would be 10029 in the year 2019, for example. These are pretty much what you would expect from energy data because it follows what some people call the Falcon curve, which is a distribution where you see the highest energy use in peak summer and also peak winter. So my hypothesis here is that part of the variation that we see in these energy curves is driven by energy insecurity. Or said differently, that at similar temperatures, different zip codes may have differences in their dose-response relationship between temperature and electricity utilization based on the local demographics, the local socioeconomic status of those communities. So essentially, our low-income communities exhibiting forms of energy rationing with higher temperatures relative to higher income communities. To do this, we did a few different geographical and GIS forms of data analysis to get all of the data into one type of unit, in this case, zip codes. We then took temperature data and we turned that temperature data into cooling degree days, that metric that I mentioned earlier. But in this case, we did what are called heat index cooling degree days, which I'm sure everyone's familiar with the heat index. It's essentially how hot does it feel outside, so that it incorporates humidity in addition to the dry bulb temperature. So we calculated these cooling degree days with heat index to get a better sense of what people would feel in a particular location. And then we took that energy data and we downscaled it essentially down to the building level and to try and get a sense of what was going on in terms of residential energy use. These are some descriptive plots so you could have another sense of what these data look like. So these are essentially plotting by income group, the average energy use by month across years. And so you could see, as you would expect, that lower income groups are consistently using lower energy and higher income groups are consistently using higher amounts of energy. But given our hypothesis here, what we're less interested in, what we're more interested in is essentially around the slopes of energy use. So this is another plot of the underlying data where the bottom row are histograms of the energy use across the entire data set, broken into climate region of the US. So those are the three panels. And essentially how much energy was being used in a zip code in a given month. And so the top row of plots are just fitting a regression line to two particular zip codes for each one of these income groups, just to demonstrate essentially what we're trying to show is if we consistently see lower dose response functions for lower income zip codes. And the punchline is much faster than the buildup, which these are the main results. And broadly speaking, our hypothesis seems to pan out, where we see relative to the lowest income zip codes, that higher income zip codes tend to have steeper dose response functions for an increase in cooling degree days. So said differently, the hotter it gets, higher income zip codes will use even more energy than the lowest income zip codes, those that use are approximately less, or sorry, those that are less than $50,000 per year median income. However, that said, I caution that we conducted many different sensitivity analyses, meaning that we tried the analysis many different ways, testing our assumptions many different ways. And in some of the cases, we find that the statistical significance goes away. And so that's essentially part of the process of seeing how robust these findings are. And we do see some attenuated or null effects in some permutations of this modeling. So this is absolutely a broad field that requires more investigation, but my hope is that this is an important contribution. That said, I'll be honest that I was a little bit shocked that we actually even saw a relationship in our modeling, because energy insecurity has been described mostly at the individual level, not at the community level. And so that we see patterns of energy insecurity at the zip code level is very interesting, and I think warrants more research to understand if these things really do add up to the fact that lower income communities are just fundamentally using less energy. And this is important because lower income communities are on average more vulnerable to the effects of extreme heat during the summer. And so this could be potentially leveraged into developing tools that could target neighborhood energy investments to the communities that need them the most. So that said, of course, this work requires a lot of folks collaborating to make it happen. So this is just some of my team that has helped with this work, as well as my collaborators, including the Green and Healthy Homes Initiative. This is a nonprofit organization that I partnered with to do a lot of this work, given their hands-on kind of on the ground work around energy insecurity and energy upgrades in low-income communities. So with that, I'll end there.
Well, thank you very much, Danielle. So are there questions? Riga has one, and then Margot.
Yeah, thank you so much. This is a completely new topic for me, and especially the measurement cooling degree days. I hadn't heard of it before, and I was curious to know how it's measured. As in, is it surface area temperature? Is it air temperature, near ground temperature? If you could go through that.
Yeah, absolutely. So
Yeah.
some of the work that's been done around temperature inequality has mostly used land surface temperature. And clearly land surface temperature is important, and yet it's not the temperature that we really experience. As you are probably intuiting here or implying here, air temperature is really more important to what we experience and epidemiologically more relevant. And so these results are all using air temperature. So we used essentially satellite remote sensing with land surface temperature, but then trained that on ground stations of air temperature around the region, as well as using a whole bunch of other covariates in a model, including earth science products, like topography of an area, to then get predictions of air temperature throughout the region.
Thank you. I was also just thinking, but it's probably not relevant to the study's result, but I was considering, could the sort of status of the homes in a certain neighborhood have any effect on the behavior? So you mentioned the higher concentration of white folks, for example, led to a lower number of CDDs observed. And I was wondering, does the type of home, like whether it's retrofitted or not, have any effect on that, or that was probably not accounted for in the model? So perhaps a retrofitted home would be set at a particular type, a more sort of regular temperature, more bearable one versus an older building, an older house. But that's probably not the case here. It doesn't account for that factor.
Yeah, no, this is, I love this question. So for the first analysis, while the housing types would potentially have some role in the area level temperature, that wasn't really accounted for in the analysis because essentially was just looking to see, are there demographic trends? Most people, when you look at a weather app, you're getting one number for an entire county. And essentially what we're saying in that first analysis is, but wait, people are experiencing systematically different summers within that region.
Mm-hmm.
So that's for that first analysis. But for the second analysis, what you're saying is actually one of the reasons why I was kind of shocked that we saw these results, because you could imagine different scenarios whereby low-income communities perhaps don't have as weatherized of homes, and therefore are potentially using more energy because, I have friends and colleagues, for example, who live in homes where they have one tiny air conditioner for an entire huge space that air conditioner is not built for. They're just wasting energy in that situation. It's not designed for as large of a space as it might be in. So examples like that, where you have these types of trade-offs, kind of might lead people to end up using more energy than they would actually need because it's not providing as much cooling. That wasn't accounted for in the analysis per se, aside from the fact that areas that are low income within a region are more likely to be like each other than areas that are high income in another region, which we essentially controlled for by design.
Thank you so much.
So Margot, did you have a question?
Yeah, it's a little bit based on Riga's second question. By zip code, and the whole idea of insecurity about energy is new to me. And so I'm thinking about the stressors and the inequality of life expectancy and how that stress adds to heat and cool and the physical stress of dealing with it all. And wonder if how solar energy with panels on each rooftop of a building or something could equalize that a little bit, kind of going back many years now to Barack Obama's putting solar panels on every rooftop. If we had that kind of a policy, would that help people feel more at ease to not be stressing out their bodies and their anxieties?
Yeah, absolutely. So I haven't done any work on renewables adoption, which is essentially this issue. I think it is an important thing to think about. Absolutely. Energy and security is relatively new. I had mentioned that my colleague Diana Hernandez published on it just in 2016. So it's unsurprising to me that you haven't heard much about it. That said, there's increasingly work on the health relationships with energy and security. So they had a paper that was just released, I think last summer, where they did a survey of energy and security throughout New York City and found really robust associations between energy and security and many different health endpoints. And so on the epidemiological side of things, more work needs to be done to kind of understand the processes that the stress of energy insecurity may yield health differences. But then on the upstream side, what we can do about supporting low income and energy insecure households, I think it is important to think about targeting renewables to the communities that can afford energy the least. Absolutely.
Can I ask one other question? Thinking about in Chicago, I can see that if you're on the west side, you are paying more for gasoline than you are in a suburb, which to me, I could never get my head around that because there's less income on the west side. But is it that way with energy? And if that's the case, what does studying New York mean for other major cities? Is it that you are in New York, you're getting a template for measuring what's in other cities, or that New York is an example for other cities?
Yeah, so in this case, it's just that New York is an example because that's where we have the data. Absolutely would love to do this type of work in other places around the country where we have access to the types of data we need. There is a scholar, Tony Reams, who has done a lot of work about this notion of heating use intensity in low-income communities, essentially requiring more energy for heating their homes during the winter. And then also work that's been done in New York that I've been part of, that the energy mix for low-income buildings may be more polluting. And so perhaps the energy per unit is cheaper, but it's also polluting more. And therefore, we're paying for that on the back end with potentially people's health outcomes. So these are amongst the many things that we're thinking about when we're thinking about these kind of energy trade-offs for people's health.
Thank you.
So we had Huda had her hand up, and then Nick Snow had his hand up.
I can't hear you, Becky.
Hudita had her hand up, and then Nick Snow. Hudita, you want to go? You want to ask your question?
Yeah, I think Chip had a question. Chip, before me. Hello? Okay, so, well,
No, I had no question, Hudita.
Oh, okay. So, yeah, so I wanted, some of my question, I have a lot of questions, so I'll email you later, but some of them, were about the health issues, which we've begun to talk about now. But I have a question about the methods. How, if you can just say again, I know you explained your methods, but how you identified the different, ethnic groups that you were measuring. Asian, I think it was Asian, Black, Latino. What were the group? Because I mean, all of those are very diverse, right? And they're not. It's not as if in this country you don't have. Well, the neighborhoods, especially in a place like New York, are more mixed, more complex than that. So if you can just explain your methods. And then I'm just wondering if there's any work done on the household level in terms of decision making, both about expenditure, consumption, paying for fuel and for machines, air conditioners, fans, and so on, and how the decisions about paying for buying the machines as well as paying for the energy and those internal dynamics. Because, for example, with the cooking, you did a study of cooking in Ghana. Buying those I assume it's maybe gas cylinders they used. I'm not sure. Anyway, in a lot of the world, people use gas cylinders. Now, there's all kinds of complexities about who pays for them, when it's used, and it's used, many times throughout a day. And I mean, it's a very complex thing. So I'm just wondering, there are many gender dynamics also. So I'm wondering if you or someone else has done research on the sort of household gender dynamics around and decision making around really about around money, time, and labor. But let's just talk about money and time in the U.S. because we're talking about air conditioners, the usage, the money, who's deciding in the household?
Yeah, absolutely. So for your first question, absolutely, there's a ton of heterogeneity within the groups that we binned essentially into. So we use census categories for non-Hispanic, Black, Hispanic, Latino of any race, Asian, and then non-Hispanic white. And so that's essentially how we got those categories, was through census categories that we then did that at the census tract level. So those were the demographic groups that we used. I think this could be one of the reasons, for example, that we saw heterogeneity by state, that we saw different effects by state. So, for example, the mix of Asian people in New York is very likely very different than the mix of Asian people in Delaware, let's say. And so that type of patterning is not something in the way that we constructed our study was something that we could tease apart. So that's to your first question. And then to your second question, more on the decision-making side, I think it's a really important question. And right now, we are just kind of identifying broad trends that we can then dig into with much more nuanced forms of qualitative research, which I think is the type of research that we would need to at least start off to understand some of these potential gendered decision-making pieces as it pertains to energy. This is absolutely something that people have done around energy in the context that you had mentioned around cooking in many parts of the world, and some of my own work. We've done some of that work. But as far as I'm aware, folks haven't done the same type of work yet in the US around these types of energy decision making.
Okay, I just one, just one. I know we're over a time. Okay, well, I forget it.
I was going to say Nick had one last question, and then we'll close.
Thanks, Daniel. Thanks for the research you've done and pointing me to your 2024 paper. I actually have two quick questions. One, you don't have to answer, which is what funding issues have you had since January 2025 in terms of your research? And two, I'm a member of Virginia Clinicians for Climate Action, and we did a study in Virginia, got an EPA grant in Heat Ready Roanoke, and though it basically was with Carrion Clinic and Virginia Tech, and it was mainly on the health aspects of heat. But we did refer people to Virginia local Social Security and other sort of to get funding for help. It's not a research grant, it's more a treatment grant. And just wondering, had you worked with any local groups along those lines? So thanks.
So I'll probably punt on the first question and happy to chat another time about funding concerns. With regard to pointing folks towards groups and collaborating with different groups. So I'd mentioned the collaboration with the Green and Healthy Homes Initiative. Another group that has been really keen in thinking about energy and security and temperature for low-income and minoritized communities has been We Act for Environmental Justice. They came out with this is an environmental justice group in New York City, and they came out with an entire report essentially about summertime energy and security. So they're very interested in some of these issues. And so we've done some work thinking with them around the energy transition broadly and energy issues. Absolutely, these groups are thinking about and working towards addressing some of these issues.
Well, thank you so much for your time today. Really interesting concepts
Yes.
presentation, and we really appreciate you joining us. Thank you again.
Happy to be here. Thanks for inviting me.
Yeah, thank you, Danielle.
Bye.
All right, bye.